This next section I will be describing the instep soccer kick in detail. The movement of an instep soccer kick consists of 6 different phases of the approach, backswing, downward motion, foot contact, and follow through. The motion occurs by segmental and joint rotation in all 3 planes, and it is a proximal to distal segmental motion. And that's from Kellis and Caddis, an article. And a majority of the lower extremity movement occurs because of second and third class levers. To begin, I will talk about the backswing phase. So as we talked about in the general description, that's when the leg's extended and the knee is flexed. According to an article by Alyssa Vaselli, the player must begin the motion from an angle of about 43 degrees to ensure lateral inclination. The approach may consist of about 2 to 4 steps to help them generate speed to strike the ball. So the player starts the motion by running up to it. There would be no momentum or speed created if the player did it by standing still. During the backswing phase, extension and adduction happen within the acetabular femoral joint. So as her leg's back, in the acetabular femoral joint, the extension and adduction happens. And in addition, the flexion occurs in the tibiofemoral joint, so down here, and the plantar flexion in the talocrural joint in the ankle. The gluteus maximus and the gluteus medius concentrically contract to extend the hip as our hip is back, and the concentric contraction of the gluteus medius and gluteus minimus allow the hip to abduct. The iliopsoas group, located in the hip, eccentrically control hip extension and works as an antagonist to flexion of the hip. The adductor group works as an antagonist to the adduction of the hip. And the flexion and extension motion works as third class levers. While the hip is extended, the knee is concentrically contracting to flex using the hamstring muscles, including the bicep femoris, semitendinosus, and semimembranosus, along with the sartorius. The gastrocnemius is also concentrically contracting to plantar flex the ankle. So as her foot is pointed down, it's the gastrocnemius in the back of her leg is concentrically contracting. The antagonist of the plantar flexion of the foot motion is the eccentrically controlling of dorsiflexion in the ankle from the tibialis anterior. The extension and flexion occur on the sagittal plane, while the abduction of the hip occurs on the frontal plane. The greater the eccentric stretch, so the greater her leg goes back, the hip flexors and knee extensors work during the backswing, the greater the force production will be during her follow through. The next phase is the downwards phase as her foot swings through. The hip is now flexing in the acetabular-femoral joint, and the knee extends in the tibiofemoral joint. The speed of the foot during this motion is highly dependent on the mixture of hip rotational torque, so as her hip comes forward and swings across, and the strength of the hip flexor and the quadricep strength. This is all from Vaselli again in her article. And the first motion during the downward phase is the concentric contraction to cause hip flexion in the iliacus and psoas major, and the quadricep muscles consisting of the rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. And the rectus femoris acts as a third-class lever in hip flexion. The effort is the distal attachment, and the entire leg is the load. To activate the extension of the knee, the quadriceps, mainly the vastus lateralis, work concentrically. In order to control the motion of kicking forward, the hamstrings work antagonistically to eccentrically control the movement. The hamstrings also work as a third class lever, with the knee as the fulcrum and the load as the leg. And the point of insertion of the hamstrings on the tibia is the effort. The isometric contraction of the gastrocnemius keeps the ankle plantar flexed. And the gastrocnemius works as a second class lever with the ball of the foot as the fulcrum. The load is the body weight and the effort is the gastrocnemius contracting to lift the body weight. The next phase is the foot to ball contact phase. The foot contact phase is when the foot comes in contact with the ball during the swinging motion. The support leg in this time, or left leg, is flexed when the foot makes contact and extends through the rest of the kick. The forward motion begins with the rotation of the pelvis. So as she's coming through, her pelvis will rotate in and from the hip adductors as the kicking leg swings forward with a slightly flexed hip and knee. So this is when she's not fully extended yet, she's just slightly bent at the hip and knee. In addition, the foot moves upward and forwards because of the momentum created during the segmental forces of the thigh, shin, and foot. The main joint that moves during this motion is the talocrural joint as the ankle concentrically contracts to cause flexion. The antagonist of flexion is the tibialis anterior eccentrically controlling plantar flexion. Lastly, we have the follow-through phase. The follow-through phase allows the body to decelerate from its forward motion that is created during the forward motion of the swinging leg. The follow-through phase is vital to keep the foot-to-ball contact for as long as possible to increase the speed of the ball. It is also vital for protecting the player's body from injuries that may occur when coming in contact with the ground. The eccentric contractions that control the follow-through are fundamental to dissipate kinetic and elastic forces. The hip extensors and adductors and the knee flexors all eccentrically control the slowing of the swinging leg. So a majority of the follow-through phase is eccentric to slow down the body to prevent injury. In addition, the three gluteal muscles work eccentrically to abduct and medially rotate the hip. So as she comes across, it's going to medially rotate. At the knee, the hamstrings eccentrically control flexion at the knee. In order to prevent the kicking foot from slamming on the ground, the concentric dorsiflexion converts to an eccentric controlling plantar flexion to slow the velocity of the foot down. So after she swings all the way through, she's going to land on her kicking leg, and the landing phase is when the body has come to a complete stop and is standing straight up. So that is the detailed description of the motion. Next I will be going into some ways to practice this to become an expert with the instep soccer kick. Good.